We have a patient with us today that called me on the weekend, and her dentist said she needs a root canal. The patient thinks she needs a root canal. Let's find out if she's gonna need a root canal through an excellent endodontic diagnosis that we're gonna do. We're gonna have, the first test that we do is the cold test. Amanda's gonna write the results while I'm going in different teeth. The patient doesn't know, so she doesn't have bias. This is the tooth that you feel the cold, right? That you say you feel the cold, and you feel the cold. And all these teeth means that is normal, Amanda. So 6, 7, and 8 are normal in the cold test. And we are going in number also is normal. And we jump this one because she has a root canal treatment. And why is important the cold test? We do it in endodontics, is the best test because it's the one that is gonna tell us if the nerve, like the patient call it, which is a vascular system, is alive or not. And in the American Association of Endodontists established that after 6 seconds, then we're gonna have a root canal treatment. The patient wasn't waking up at night, it's just pain with hot, and sometimes all of the sudden, but in this case, she fractured a little piece in this area, and we are thinking that is some water leaking through this tooth, so she's gonna go back to the dentist after we know if it's a root canal or not. Bite, any pain. This bite test, we do it to check if it's an infection on the end of the root. The x-ray doesn't show anything. You're gonna see the image later on. And it doesn't show anything on, any pain? She doesn't show anything with in the infection on the roots, which will be in this area. And there's the other test, which is palpation, and then I'm gonna do the probing. So the palpation is negative, any pain? And palpation also, if the patient has a big abscess here, and is not showing anything around the gums, then I will feel it and the patient will jump. But she's not jumping because she doesn't have an infection. It's just the sensitivity. And one of the last tests is a test where we measure the gums, and we see very gentle because it's sensitive, and the patient has some anxiety to the dental chair, like many patients. So now I go to the last teeth. And this is very important to check in case we think there's a fracture. If these measurements go all the way in here, this probing instrument is to check if we have any. Once we go to the back in a fast way, more efficient, the patient is normal. And we have the last one with this instrument that we're gonna check mobility. And Amanda, this 8 and 9 have, if you can see here, lines of crack. The patient had already orthodontic surgery, and she's going to a full mouth reconstruction. This is to check if her teeth have some mobility, in case it's bone loss, which we don't see on the x-ray. But I go through all these steps. So now, we know that most likely the patient is not gonna need a root canal. The x-ray doesn't show anything, and I wanna give you the good news. Mrs. Smith, because we don't say her real name, she let us record, that this is not a root canal. So you better be careful when you have a toothache. Be sure if the patient is grinding, if you are clenching your teeth and she has this problem, I have to be sure if she's wearing her night guard or any protection for her teeth. The other that can give you pain could be that you bite by accident. She broke a little tip on a tooth. She went in a trip. Now she has to fix it. That could be a possibility that you have pain, but not everything is a root canal, so be careful. When you have pain, be sure your endodontist go through this diagnosis. If you don't have constant pain, not spontaneous, it doesn't stay more than 6 seconds, it doesn't wake you up at night, you don't have to take pain medication, that is not a root canal, and I'm happy to give you the good news to the patient. Thank you, I hope you enjoyed this chapter of our show. Dr. Fanny Yackaman, Follow us in Instagram and TikTok. Thank you.